physician's assistant at Performance Medicine. I know most of you all here. Thank you for coming to our first series of Empower You, where we're going to have 7 weeks where we discuss different topics that we feel are very important to overall health and looking at the patient, looking at ourselves holistically. It's not just about nutrition, though that's what we're covering today. It's about sleep, about movement, about exercise, about making sure that all your joints are working exactly the way they should be, Dr. Gorman. So there's really, really cool stuff. We have a special guest today, Ashley with Smash Meals, who's going to tell us a little bit about her business and how you can get some really good foods for low cost and very conveniently eating. So I feel like a lot of what we do, we're deterred by convenience, and this is totally taking that out of the equation, so it's really cool. Thank you all for coming. And we have our resident boomer in the back. I don't know if y'all know the hashtag OKBoomer, but if you look back, you'll see that he may not look almost 65. I said your age, I'm sorry. But so Dad is here, Dr. Rogers, he's going to help out too with today's program. So let's get started. Nutrition. Any specific questions you have too, we're going to have a Q&A. I want to kind of knock this out in about 20 minutes. Our program outline is going to kind of go over food basics. What are we eating? And we go over kind of the big three, carbs, proteins, and fats. What are they and where are they and what is good and what is bad in a general overview. Then we'll go into kind of the popular nutrition protocols and diets. A lot of people come into the clinic and ask questions about should I be in ketosis? Should I be fasting? Do I need to follow different diets? I actually didn't go through paleo on this one, but what do you think? What's best? What works for you? We'll kind of go over the most popular ones. If you have questions about any other specifics, just let me know. You are what you eat. Abs are made in the kitchen. I don't know who said that, but it is so true. Everybody comes in and says, I need to exercise more. Everybody needs to exercise. Everybody needs to move. But when we're talking about weight loss, specifically with nutrition, you are what you eat. I like to want everyone to compare themselves to a car. You're an engine. We are engines, and we use food sources, fuel, to feed ourselves to move and do things. That's just basic biochemistry. That's how we work. So in your car, if you think about it, if you put junk into your car, it's probably, if you go out and you mix a bunch of mud together and put it into your engine, is it going to start? No. You won't make it very far. If you put premium gas into your car, or at least gas into your car, it's probably going to run a little bit more. You change your oil out too. You protect your car. These are all things that we put into our car. So that's how I like to blanket nutrition. What you put into your mouth is important, and it is worth the cost of buying good foods. A lot of people say organic is expensive and non-GMO foods, I can't afford those, I want to eat here. It is worth it. It is something you're putting into your mouth. If you think about it, when you're born, what's the first thing you do? What's the first thing you get? Food, right? Food comes from mother or comes from bottle. That's touching the mucosa in your mouth. That's the first part of your immune system is through your mouth. So thinking about what you put into your mouth is super important and underappreciated in our culture today especially. So I want you to think about that every time you eat. So what are we eating? Carbs are my favorite. I love carbs. Kelly loves carbs. My sister, we're both type 1s. And all we do is type 1s. All I do every day is I count carbs. So for breakfast this morning, I had an English muffin, I had a scoop of coconut yogurt, and I had 3 raspberries. All 3 of those portions of what I ate had carbohydrates in them. So what do I do as a type 1? I count them and I give insulin. So when I want you to think about carbohydrates, I want you to think insulin. Every time you put a carb into your mouth, your body is spitting out insulin. And mine is not because I don't make insulin, so I give it. So that is a response to carbohydrates. What is a carb? Carbon, hydrogen, and oxygen. That's what it is in a different structure. And I want you to think that it breaks down into sugars. Sugars are the most important part of it. Good carbs and bad carbs. This is just kind of overview. Anything high on the glycemic index. We talked about low GI foods and high GI foods. So foods that are high in the glycemic index, it's scored usually from 0 to 100. So higher up on the list, I think there's a specific marker of 70 and above is high glycemic index, and lower than 50 is low glycemic index, and you can Google everything. Foods that are higher on the glycemic index are going to spike your blood sugars and increase your insulin. Insulin antagonizes blood glucose, so those are both going to spike. Think of anything that you would think is bad for you. Sugar, candy, potatoes, refined flour, breads, pastas. Think about what you do when you go to Bonefish or Olive Garden. They're putting a big fat plate of bread right before you start eating. It's chock full of carbs. Does anybody know how many carbs are in a slice of bread off the top of your head? Depends on where you're going. Do you know?
They want to know.
Okay, so if you're getting a typical slice, the number that always comes to my mind is 20 grams per slice. And that's usually a thin slice of, think of a thin slice of Wonder Bread. If you go to Panera, a sandwich at Panera is going to have upwards of 45 grams per slice. I usually get that, what's that, bacon, tomato?
Bacon turkey bravo.
Bacon turkey bravo. Yeah, bacon turkey bravo. Each slice has 45 grams. I love doing carb counts because Kelly and I do carb counts every day. Low carb, if you're on a low carb diet, you're going to be anywhere between 50 to 60 grams per day. You eat one slice of that Panera sandwich, you're already at your load for the day. Typical U.S. intake is between the 200s and 300s every day. So think about, if you're in ketosis, which we'll go over that diet, 20 grams of carbs or less a day. So you are out of ketosis if you eat that one slice of bread from Panera. And think about it, that's a thick slice. That's the slice that you're getting before you eat the meal at Bonefish or before you eat the pasta at Olive Garden. It's crazy to think. Good carbs. Carbs are also in fruits and fiber and vegetables. Fruits are going to be a little bit higher up on the index depending on the fruit. Vegetables, in my mind, I always think it's usually about 5 grams per handful or so or serving of vegetables. And I think of vegetables like leafy greens. So those are ones that we want to choose. Next thing, proteins. Everybody always thinks more proteins are good for you. It kind of depends on the person. It's not always the case. When does actually protein become bad? The thing that comes to my mind is anybody that's a kidney patient. So we want to be able to filter and use proteins. If you have kidney problems, you usually don't filter them as well. So they usually decrease your protein intake. These are general guidelines of adult men needing about 56 grams per day. Adult women needing about 46 grams per day. It's going to increase with athletes, with anybody that does the bigger activities like CrossFit or Olympic weightlifting. You're going to probably need more to rebuild because what are proteins doing? They're amino acids. It's a long chain of amino acids that provide function, structure, tissue repair. It helps everything in your body. It sends signals as well. So when I think of proteins, I think of your bones, your muscle, your cartilage, your skin, and your blood. Proteins are good, but you don't want to only have proteins. It kind of just depends on your body and your chemistry. Generalized good proteins versus bad proteins. Think of fish, liver, eggs. I like omega-3 eggs for this. I think it's important where your eggs are sourced. Grass-fed beef, this is also another thing. When you think of your meats, you think of proteins. And I do think it's important, and Dad, correct me if I'm wrong, buying organic chicken and poultry is very important. My cousin, mom's cousin, my second cousin, is a surgical breast cancer oncologist. She's a phenomenal physician and surgeon out in Little Rock, and she's seeing a huge influx of younger females getting breast cancer. And why is that happening? There's a million reasons why. If you have something in your history that is part of that history, that's part of the, oh, you're on estrogen, it's because of estrogen. Oh, you did this, it's because of that. She thinks it's because these younger females are eating a ton more chicken. It's the chicken and kale girls that are wanting to lose weight. They're eating healthy, they're choosing good things, but that chicken is not organically sourced. It's chock full of hormones. So if you're going to buy anything organic, if you choose one thing, I would buy organic chicken. But grass-fed beef is going to be along the same measures as well. Bad proteins, soy proteins. Why? Because soy can be a little bit estrogenic. With estrogens, we're going to talk about hormones next week, which will be really fun because I love hormones. Too much estrogen is not good, and too little estrogen is not good. I compare estrogen to your mom. Okay, so estrogen, you want her there most of the time. If you want her there like 60 to 80% of the time. She's going to protect your heart. She's going to protect your bones. She's going to make sure if you fall, you're not going to break that bone. You have some structural fat because she wants to feed you and feel good. But if she feeds you too much, or if you feel bad, you're going to go crazy, right? If your mom hormones there all the time, excluding my mom. Thank you, Mom. It's going to drive you nuts, right? So you don't want it there all the time. And soy proteins and soy-based alternative meats too. A lot of this, we're going into a lot of alternative meats with Beyond Beef, with Impossible Burger, knowing what's actually in those. I believe Beyond Beef does not have soy products in it. But it's just nice to know that what is actually being the alternative for those alternative meats. Nitrate-containing products, hot dogs, bacon, it's just not great for your system. Thoughts on nitrate-containing products? Just bad? Okay, no reason why.
Well, they're carcinogenic, so we stay away from it if you can.
Yeah. Tell that to the 4 slices of bacon he had this morning. I'm kidding. Okay, and hormone-fed meats. So, proteins. Next thing we have are fats. So fats, there's this common misconception, and definitely there's some great documentaries. Everybody thought fats were bad for you in like the 90s. Everything was fat-free ice cream, low-fat yogurt. Fats are good for you. You need fats. If you're not eating fats, then you're eating carbs or you're eating proteins. You're only eating a certain number of things. So if you cut down on this, you're eating more of the other stuff. If I'm going to choose between the 3, I'm choosing proteins and fats over carbs because I don't want to get insulin. So fats, what are fats? Mainly carbon and hydrogen, and they're arranged in a certain way. This is where it gets a little bit in the mud about polyunsaturated fats, monounsaturated fats, saturated fats, trans fats, what's good, what's bad. It's the way that they're arranged. So what stays liquid at room temperature and what stays solid at room temperature. That's basically the shape of the molecule. So what's bad? Generally, trans fats are bad. Polyunsaturated fats are good, and saturated fats are kind of in the middle. That's just a general rule of thumb if you need to choose between the 3. What do fats do? They provide energy, they provide structure, and they also absorb really important vitamins like A, D, E, and K. I used to work in a cystic fibrosis clinic, and these kids usually have problems with their pancreas, so we have pancreatic insufficiency. Your pancreas helps with vitamin absorption. You need to take fat-soluble vitamins. So the fat, they always call them Aquadex, so these kids would take A, D, E, and K, and that was their mnemonic for it. It was called Aquadex. Those are super important for everybody to have. If you don't have fats, you won't be able to absorb them. General, this is kind of too, you would know these, you know a bad fat when you see one. Cookies, high fructose corn syrup. Okay, so when we were kids, I swear this really happened. This would not seem like a Rogers thing to do now, but we actually did this. So we'd sit down, I'm sorry I have to tell this is true. Thank you, cerebral PCB. But we would sit down with these Hungry Jack biscuits, the flaky ones that you could just tear.
Yes.
And then Mom would have that as our side with butter and literally K-Rose syrup on the table, which is just high fructose corn syrup, which I didn't really know until I went to college that was, I was like, oh yeah, high fructose corn syrup's bad for you. I was putting that on my biscuits forever. That's fine. So
I loved it.
we know better now.
I cannot be
high
ashamed.
fructose corn syrup is K-Rose syrup, so it is just, corn is just a subject all on its own. But peanuts can be inflammatory, which is why we try to typically avoid those and go for the alternative, the almond butter. And it's a legume, it's not really a nut. Refined vegetable oils, you want to choose the better oils, the coconut oils, flaxseed. Good fats can come from avocados, from nuts, from raw cheese, and from almond butter. You know a good fat when you see one, and it's important to have. Let's go on popular diets. Things to consider with this is what I get kind of pushback on is what's actually feasible with these. It's like, okay, great, you want me to intermittent fast, you want me to have ketogenic diet, like I can't do that. You want me to buy organic chicken and follow this plan, I can't do it. I work, shift work, and I work at night. Like, I get that all the time. I'm graveyard shift, I can't do this. And so it's important to kind of, I think planning is important, and with Smash Meals too, that's where it comes so in handy, is the planning portion of it. A lot of people will take Sunday to cook for the meal, and the biggest success for me was meal prepping, because it forces you to know exactly what's in your meals. You save money doing it, and getting a crock pot. Crock pots are easy. So finding out what's feasible for you, but also seeing what your goal is for it. So you notice, if you start doing Botox, let's go for Botox for a second. You start doing Botox and you don't really know why. So you just start doing it and you don't notice the change. If we don't take a picture of you doing Botox at the beginning to after, you don't know why you're spending that amount of time and money on it. You don't know the change. So I think setting a plan and setting a goal, I want to do this to lose weight, and here's where I kind of want to be. I want to do this because I feel like I have brain fog, and I'm not eating well, and eating well will help me think clearly. See where you get that goal and setting a plan at the beginning. And also seeing if you have support groups. Support groups are great. Google and Dr. Google can be bad sometimes, but in other times you find really great recipes. When patients come in and start HCG, all the time they're bringing in recipes and ideas from the internet that fit the protocol and are great and tastier than what we had put in our protocol book. So I always Google, but take it with a grain of salt. Ketogenic. This is the first thing we're going to talk about. Ketosis. So basically this is eating more fats. So it's going to be about 80% of your intake for the day and less carbs. So ketosis, there's different things online about how many grams per day. Usually shooting for 20 grams or less of carbs per day. So someone tell me what they ate today. Rhea.
Oh gosh.
Tell me what you ate for breakfast. What's your ketosis? What did you eat for breakfast and what did you eat for lunch?
So I'm not a breakfast person, so coffee for breakfast.
So you're intermittent fasting, that's fantastic. We'll go
Oh, that
over
is good?
Yes,
Okay,
you're
okay.
killing it. You're killing it.
And then lunch, it all went downhill. I had chilies, quesadillas, there was bacon on it. Yeah, I know.
It's okay. No,
And
I
cheese,
did not.
yeah.
Listen,
Yeah.
I did not mean to put you on the spot for that. So quesadillas, the tortilla is going to have that's going to be the carbs in it. Usually anything in between in a quesadilla is usually going to be chicken and cheese. Those are free foods, no carbs. Some of the vegetables add maybe a little bit, but not much. So whenever I count for quesadillas, I just count for tortilla. It would put us out of ketosis for that one meal. But I just wanted an example that it's sometimes hard to get. It's hard to get to ketosis. So what does this do? Ketones and the way ketogenic, that actual word, ketones are a byproduct of fat. So when we're burning fat for energy, we create ketones. It's different in the type 1 world whenever people say, oh, ketones are bad. They are bad when you're in diabetic ketoacidosis, which is different. It's a different mechanism of action. You don't have insulin on board to help control glucose, and the ketones basically turn your blood acidic, and it becomes deathly. So I want you to differentiate. This is not ketoacidosis. This is ketosis. And the way to check ketosis is actually a blood stick. You check your finger, prick your finger, and you check if you have ketones. And I believe the ketone range is anywhere, I think from 0.3 to 2 is the ketone range that they look for. So how do we do it? 20 grams of carbs or less per day and check blood ketones. And this, are we able to share these PowerPoints? We can maybe share these PowerPoints. This is a yes-no list, and I just Googled this. You think of anything, think of fats and proteins with this. Things to watch out for. Have you heard of keto flu? People will get kind of lethargic starting off with keto. Whenever you have a massive shift in the things that you are eating, your body responds and it thinks that it's going into shock mode. So you may get keto flu. It's usually for the first couple days, but it's actually kind of a normal response. And other things that people will notice with ketogenic diet is a drop in blood pressure and blood glucose, which is normally for 99% of people a good thing. But if you're on anything that's going to add to it, say if you're on a blood pressure medication, it's nice to watch for that, and you may need to decrease it. Intermittent fasting, what is, Rhea, thank you for your example of intermittent fasting. It's really only eating between certain periods of time throughout the day. A lot of people like using this. Dad likes using intermittent fasting. He is an intermittent faster. There's different protocols. If you're interested in really getting into the specifics of the science, there's a great website. He's Dr. Fung, F-U-N-G. He's a Canadian nephrologist, and he loves intermittent fasting for kidney health. Why do we do this? It's eating for a limited amount of time to allow for promotion of gut health, reduction of toxins, and increases human growth hormone. These are 9 different benefits of it. If you think about it with fasting, a lot of religious groups fast. Like, what's one of the Jewish ones? Starts with, no, but it's
Christians?
no, there's a specific one that, I'm in something so I can't break fast. You know what I'm talking about? We're not in New York or Florida, so I guess this is something here. Oh God, I don't know. Sorry for Facebook. Shoot, I'll think about that one. Religious groups fast all the time, and they fast, and I think part of it is, yes, from the books, this is something that's traditional, but a lot of times I think it's for health reasons too. I went to a conference a couple months ago led by integrated medical docs from all over the country. Whenever you go to these conferences, you know where you at. If you go to an aesthetics conference and a Botox conference, everybody looks like they've got Botox. So this one, everybody looks super fit and young, and they're all in their 70s and they look incredible. I was like, and you want to look like them. And they talk about the best thing that you can do for your body is a true 3-day fast. They said that's the best thing you can do. That's when you have turnover from cell senescence, from cell aging and cell death, and promotion of gut healing. They say true 3-day fast. Intermittent fasting is just a way of doing it. It's a feasible way. A 3-day fast is hard. It's just hard to do water only for 3 days. So starting off with the intermittent fast and seeing how you're doing, I noticed a lot of patients, a lot of male patients especially, lose weight off intermittent fasting. What do? We eat for only 8 hours per day. This is just one of many protocols. There's a 12-12 intermittent fasting. 16-8 is the most popular one. You eat for only 8 hours per day. You don't eat any later or any earlier. So skipping breakfast, and then the countdown's on. So if you started at 12, we have until 8.
Awesome.
So what's best? True 3-day fast on Dr. Fung's website. Fasting mimicking, and this is what we just talked about with Prolon, and we have brochures on Prolon too. We're not sponsored by Prolon, but we would love to be sponsored by them. What is it? It's a fasting mimicking. It's like fasting without fasting. It's fasting while you're eating. So the scientists out in California came up and did a ton of research with cellular testing on what foods do not create a response from your gut. So it's foods that evade cellular detection. So they send you this box of food, and a lot of it is soups. A lot of it's soups. But what they do, soups and teas, it tricks your body into thinking that it's fasting when you're not fasting. So you get the benefits of a fast without the fast. It's pretty cool, and it's a 5-day program. The foods are chosen, so they send them to you. Why stem cell-based rejuvenation, maintaining metabolic markers, quick abdominal fat loss. I think it's pretty cool, and I feel like if you are interested in fasting and cannot do a true 3-day fast, this is one to try out. And the doctors at that conference actually backed this one up and said it's good. Autoimmune diet, I love this one. I think it's so cool. His name is Dr. Gundry. He was a cardiothoracic surgeon out in Loma Linda, California. World-renowned surgeon, had tools named after him in surgical techniques. He was following a very specific life. He was vegetarian, vegan, he was choosing all the right stuff, and he gained 70 pounds, had metabolic syndrome, his cholesterol was through the roof, and he felt awful. And so he thought, why? And he says, well, let's look at the things I'm eating. So he says that plants and animals have defenses against us eating them. They want to survive and produce offspring and reproduce just like we do. If someone's going to pick you up and eat you, you're going to do everything you can to make sure that that doesn't happen again or to your kids. Think about plants doing the same thing against us. A tomato does not want you to come and pick it up and eat it. It wants to reproduce and make more tomatoes and have tomato fruit. So plants have different defenses against doing it. It's not just, if you think about spiky foods, a kiwi that has the spikes. Kiwi is a bad example. What's that? A kumquat?
Pomegranate, maybe?
What's that? There's you can think about, there's different ways that they have defenses. It's not just the rind and the shell. Yeah, artichoke. It's spiky. You have to be very adept at getting into it. You need thumbs probably to get into it to be able to eat it without cutting yourself. That's its defense against you eating it. So what about a tomato? It doesn't have it soft, it's plump, it's sitting right there, it's stuck to a vine, it can't run away. It does it by the seeds. So the seeds are soft seeds. And Dr. Gundry goes very specifically into hard seeds, peach pit. So peaches want to be eaten, tossed, and grown again. Soft seeds want to stay where they are. So what do they do to you? They make you feel like crap. What's the number one thing with GERD, with acid reflux? They tell you, do you eat any tomatoes, salsa, spicy foods? It's going to upset and cause acid reflux. That's usually from the seeds causing that. Jalapenos. You ever just bite into a pepper? What does it make you feel like? Your eyes water, you gag, cough, you're hot, you have a reaction to it. Your body's trying to tell you never to do that again. It doesn't cough that up, it's causing a reaction. So Dr. Gundry, he goes way into detail with this, which I think is really cool, but he's big on lectins. Everybody says glutens are the enemy, but glutens, he says, are the scapegoat for lectins. Lectins are the big family tree that glutens belong to. And he actually thinks that wheat, germ, and gluten, and you can look on a nutrition label and look at the ingredients, and you will see wheat, germ, and gluten. That's going to cause just as much inflammation and damage as gluten does. But it's celiac disease, everybody goes for gluten, but lectins are his big thing. So what does this do? Avoiding these foods that causes inflammatory reaction is going to make you feel better. The gut wall is very thin. If you ever heard the term leaky gut syndrome, it's not truly like a medical term, but it's proposed that the gut wall is so thin, which your gut, remember, provides your immunity. So your gut wall's thin. You get something in there that's going to break through, like a lectin, like gluten, it's going to come in and cause a response. They've attributed, type 1 diabetes is such an easy subject for me because we've lived with it. They've thought for a long time that it's caused by dietary intake at a certain genotype with diet that can cause it. There's other theories too, but there's something to this to where there's a reaction. For whom it works best, Dr. Gundry says arthritic patients, patients with thyroid problems, with weight gain that they can't explain by hormones, unexplained abdominal pain, IBS patients do very, very well on autoimmune diet. We have a very specific, he has a yes and no list, and I think it's fun just to give to patients and say, where do you fall on this? Do you have a lot of no's? Do you have a lot of yeses? How do you feel? I think it's a really, really good one to try. I think it's fun. And it's not as limiting as you think. HCG, human chorionic gonadotropin. HCG is the pregnancy hormone. This is one of our most popular diets that we do here. I feel like it's a great protocol that we have starting in the 1970s by Dr. Simeon, where he came up with this protocol and adding a hormone to help with quick weight loss. HCG is a hormone that you pee on a stick and you say, I'm pregnant. So what does that do? That allows for the transfer of fat from mom to fetus to help baby grow and protect. Moms, she's there all the time. She wants to give you that fat. She wants to make sure you are protected. Nothing is going to happen from mama bear. What happens when you don't have a fetus? You think your body, you trick your body into transferring that abnormal fat, that third type of fat that's hard to get rid of with diet alone, and you pee it out. That's how HCG works. It works best with a very strict 500-calorie diet. It used to be only 40 days, and now we can do an abbreviated 26-day program where you're injecting this hormone every day to allow for that transfer of fat. It used to be billed as a pound a day, but we found that it varies from patient to patient. And also, too, every patient is not the same. So say if someone goes on HCG and they have thyroid issues, which contributes to weight gain metabolism, they won't do the same that somebody else has. Yeah, it's billed this pound a day. I love the HCG diet. If you're wanting something that's quick and focused, I've had 2 patients specifically want to lose very little weight. This is normally like, I say, if you want 30 or more, this is a great one to start off and reset. But some people are like, I want to lose 3 to 5 pounds. I want to do HCG. They tell me that it is like being on Adderall. They say they are focused, they're clear-minded, they get things done. They end up losing the 3 to 5 pounds, but it's not just for those. A lot of people think HCG has to be the one that you need the big weight loss. It does help with that situation, but anybody can do it. I did this. Okay, Andy has 2 different lunches. I just want to see if kind of like baseline what you all might know about carbs. because I count carbs, and what does carbs do? What does it spike? Insulin and, so what does insulin antagonize?
Inflammation.
Inflammation, okay, yes, inflammation is good, but what does insulin work against? If you have high something, you need insulin. Glucose, thank you. So you have high glucose, high insulin. So my lunch number one, so I had 2 slices of mellow mushroom pizza with pepperoni and mushrooms. Not much, I'm a big guy, I weigh 190 pounds, 2 slices is probably not a huge meal. And a house salad with dressing. How many carbs do you think are in this lunch? Just, you can ballpark it. 2 slices of pizza, not much.
60.
60? 60 is a good guess, any other guesses? It's upwards of 90. So 90, and that's not counting the house salad, that's not counting the dressing. So I always count salads as free, even though that probably has 5-ish in there. The dressings are also chock full of sugar too. Each slice of mellow mushroom has 45 grams, and that is for a basic slice of pizza there. So how much insulin do I give in response to this? This is a hard question. So we come up with ratios as type 1s. Mine's 1 to 10. So I would give upwards of 10 units of insulin just for this meal alone. And I've worn a sensor where I've done this, and my sugar, I will give insulin 30 minutes prior to this meal, the exact number I'm supposed to give, I wait and let it kick in. I am killing it as a type 1, and my sugar still spikes. It spikes through the roof and comes right down. So I'm doing, every time you think of glucose spiking like that, glucose lives in the vessels, right? It's like little ninja knives, and it's just nicking you as you go down. And that's what it's doing at every spike, and it's causing inflammation and damage to your vessels. I'm illustrating a point not to scare anybody. You can have pizza if you want to have pizza, but that's on a micro level, that's what it's doing. My second lunch, I have chicken salad on a bed of lettuce from Fresh Markets, not sponsored by Fresh Market, a medium-sized Honeycrisp apple with almond butter. How many carbs are in this lunch? How many do you think? Less or more? Less. How much less? How much do you think?
50.
Okay, that's a good guess. Yeah, 50 is good guess. Any other guesses?
25, 30.
25. So I came up with 30. So 30, it's probably a little bit more than 30, but I always think of my heavy hitters. What do you think's the heavy hitter out of this? So I had an apple, an almond butter, chicken salad, and lettuce. What's the heavy hitter for carbs? Apple. The apple's the one that I count the most. A medium-sized apple usually has about 30 grams, 25 to 30 grams. So that's what I would count. So how much insulin would I give in response to this? 1 to 10. 3 or 4 units. I went from 10 to 3 or 4 units. Way lower on the glycemic index. Perfect. General guidelines. These all come from Dr. Rogers' Total Health book. So I'm just going to read them and just stop me at any point and if you want to explain a little bit more. Sodas, even diet, are bad for you. That is the one. If you can cut one thing from your life, cutting sodas, especially diet sodas. Diet sodas does not mean diet. They replace the sugar with sodium and with aspartame. These sucralose, these fake sugars. If you're going to choose any fake sugar, I would do Truvia or Stevia. Those are plant-based. Sodas are the thing that you can cut sodas and you can lose weight with that. There are other ways to get your caffeine fix. And I think it's a marketing thing. They put that in sugar and they make it addictive so that you want more. It's genius, but you do not have to play privy to it. Eat less and eat more vegetables. I got this from, there's the disobedient dietitian, Amber Gorley, she's great. It's like, what's just like a general thing? Most general things that come from nutritionists and dietitians are going to say, eat less, and then eat more vegetables. If you're going to choose one thing to eat more of, eat more vegetables. Never go on a low-fat diet. We talked about why we want fats. Eat foods lower in the glycemic index. High fructose corn syrup, except for my youth with Karo syrup. Oh, I miss you. Celery is estrogenic. Drink water. I had a patient a couple weeks ago, had type 2 diabetes. His A1C was 14 when he started off at diagnosis. Crazy high. His blood sugars around the 400 or 500. So he's full-blown type 2 diabetes. That's fine. He just didn't know, and now we know. Started off on 1 or 2 medications. Came down to about 8, which is huge, which is awesome. But you want to come down below 7 or get in the 6s. You want your A1C, which is a diabetes marker, you want it low. So the only thing we changed in 1 month was drinking more water. He said, I never drink water. He drank more water, like he killed it in the water game. 8 to 10 glasses, like, I mean, he was only drinking water. His A1C came down almost 2 points. His fastings came down almost 100 points from water alone. When a kid is diagnosed with type 1 diabetes and DKA, and they go to the hospital, you start fluids first. You think, give the kid insulin. Insulin's not going to work unless you have fluids for it to move around it. So water is insanely important, and we do not drink it enough. Limit fast food because you don't know what's in that fast food. I saw it in pediatric endo a lot. It's the Chick-fil-A and Starbucks diet. Every kid in high school, that's all they eat is Chick-fil-A and Starbucks. It's Frappuccinos every day, which is loaded with sugar. And Chick-fil-A, although you can get better options now with grilled chicken nuggets and different sides besides potatoes, it's still fast food. It's still additives. It's still preservatives. I had an accountant patient one time that told me she knew the bottom line difference between the shelf, you add shelf life for 3 days to one product, that bottom line just, I mean, the profits soar. So it's a marketing tool for preservatives, and that's what's going in fast foods. This broth before a meal, this comes from the Sugar Surfer, I forget his name, he's type 1. He says if you struggle with like feeling full, like with your meal, or eating less, or just like feeling full, he does broth before a meal. So broth is a great way. If you think if you go to any Asian meal you go to, you're gonna have that little cup of soup or broth. And I always think that Asians are in really great health anyways. Broth before a meal can help you feel fuller faster, and it avoids the pre-meal bread. Avoid sugars. We talked about organic and non-GMO. Dairy can be inflammatory, so we didn't really talk about just dairy. Dr. Gundry, the autoimmune diet, he chooses a specific cow. He chooses an A2 cow, a European cow, versus cows we have here, which are A1s. You can actually buy A2 milk. Dairy has just been proposed to be very inflammatory, and it's because there's specific antibodies in it. There's diabetogenic antibodies in milk. So they've linked it to type 1 diabetes, but hasn't been proven. Dairy, I would limit it if you could. Aspartame, fake sugars, the ones to choose are Truvia and Stevia. Dark chocolate, the more cocoa, the darker the chocolate, the better. That's because it has flavonoids in it. It actually becomes almost like an antioxidant dessert. So that's the one if you're going to choose a dessert. And plan your meals. I talk a lot. Was that a lot? Oh my God. I'm so sorry. I love talking. And if you gave me an hour and a half, I would still keep going. Do we have any questions? We're going to have a moment with Ashley too with Smash Meals, but yes.
So there's glycemic index and then there's glycemic load.
Yes, there is a difference between the two.
Can you explain that?
Hey, Dad, I did look this up yesterday. Glycemic index and glycemic load, because those are different, and I know that foods lower on the glycemic index are better, but and they're different numbers too, and different thresholds. I don't know the answer off the top of my head. I feel like it's going to do with how quickly it goes into your system. It spikes your sugars, glycemic load versus glycemic index.
Loads, how fast it gets in. Index is just a number on the bread or the potato.
So lower the load.
Like bananas are fruits, but they're terrible for you because they have a high glycemic index. They'll turn to sugar, barrel sugar.
Yeah.
So fruits are okay, but you gotta watch the amount of what kind and the amount of fruit that you eat. Like avoid, for the most part, bananas, grapes, mangoes, melons. Really, your food that you eat boils down to 3 things. What type of food, how much you eat of it, and the timing of the eating. All 3 are equally important. So you could eat the same amount of food, but time it bad, gain weight. I mean, everybody in this room is lean and fit, so we're kind of preaching to people that really may not need this as much as some other people, but, you know, when we put everybody on a low-fat diet, like I learned in medical school back in the early 80s, our whole country got fat because of carbs. Look what happened to our country, what's still happening. I mean, it's amazing that even the nutritionists don't know what they're doing, in my opinion. I had a patient that went to the hospital a couple months ago for an elective gallbladder. This is a type 2 diabetic. They came back post-hospitalization to see me in my office, and matter of fact, the same day, just for a check. And I asked him, how how'd your sugars run while you're in the hospital? And he goes, well, man, they ran really high. And I go, well, you know, they knew you were a diabetic, you talked to the dietitian, nutritionist, and he goes, yeah, they met with me twice. You know, so they knew I was a diabetic, I was on the diabetic diet. So I asked, what did you eat for breakfast this morning in the hospital before you left? I swear, God, this is what I said. Glass of orange juice, 2 eggs, grits, toast and jelly. That was the diabetic diet that the nutritionist prescribed that diabetic. So there's a lot of ignorance in medicine. I mean, you know, in medicine we're really way behind things. You know, I mean, you may read a report that you see on CBS News, like the big news now is intermittent fasting. It's all over the news. You know, we've been preaching that for 5 years. And so things, you gotta really get on top of it early, because traditional medicine, as Paul will tell you, is way behind. You know, they almost have to do a double-blind, placebo-controlled study to tell you that, you know, fats are better than sugar. I mean, some of it actually is kind of common sense, but, you know, nutrition is just the most important thing you can do. We're gonna try to get these lecture series on exercise, nutrition, sleep, stress, hormones. But the reason we always start out with nutrition is because it's by far the best. I mean, you know, you can't out-train a bad diet. It's like we were talking about earlier.
This is something you do every day. You may not exercise every day. You can choose to not exercise, but you're gonna eat. You're gonna put something in your mouth. So knowing what you're putting in your mouth, how you're fueling your tank is important.
And it's not that hard, you know, just a few changes, you'd be surprised at what you can do, just a minor few changes. You don't have to go keto. Not many people can do keto. You know, I prescribe a lot of keto diets. Not many people can stay in it. You know, if they do try keto, I always beg them, please do what's called cyclical keto, where you cheat a couple meals a week on it at least. You know, not with sugar, but with maybe brown rice or sweet potatoes. But it's very hard, especially for women, to stay in keto. ACG is a great diet because it's fast. 20 years ago, I told my patients that I would try to get to lose weight. I mean, you go to a typical doctor, and if you're lucky enough to have them mention your weight, you know, I need you to lose weight this year. If they did that, if they happen to do that, and then you say, well, how do I lose weight? And they'll say, well, it's simple, eat less and exercise more. That doesn't work. It's so complex, it's unbelievable. I mean, number one, everybody's different. Life is not fair. I tell all my patients, I want you to remember this, life is not fair. Your beanpole buddy may be eating twice as bad as you are, and they're beanpole, and you're overweight. So everything's different. I do think you can overcome your genetics. I really do. It may be a little more restrictive for some people. But I used to tell my patients to lose a pound a week. That's all I want you to lose. It'll stay off. That was BS. Those are what I was taught. I was taught the wrong things. I like fast weight loss. I like it because psychologically, there's a lot of mental to losing weight too. I mean, there's a lot of psychology to losing weight. Not only from why you eat something to how much cortisol you put out and all that, but if you lose a lot of weight quick, you're more likely to kind of stick to it, in my opinion. You feel so great. You're off half your medicine. You're moving around. You're more likely to keep it off, in my opinion. It's too discouraging to lose a pound a week, especially if you have 30 pounds to lose. For some of our patients, need 150 pounds. So there's a lot of ways to get there, you know, but I do think most people need help in figuring out your metabolism, your hormones, your thyroid, your insulin levels, your cortisol. You need some kind of help. You usually need some kind of medical help too to get you started. And then in the end, I think the two things that really work for almost everybody I see, low carb. Low carb. It's all about the carbs, really. And then I love intermittent fasting. You know, I know myself, I'm a pretty lean guy, genetic-wise, but I noticed I was getting this 65-year-old little bit of a roll here that I never had. I started doing intermittent fasting, just don't eat at night. And I never eat breakfast anymore. I get my bulletproof coffee, and it will tell you every morning. That's all. I don't eat breakfast. I just put my bulletproof, my Yeti, sip on it all morning. It gives me energy, and it's filling. It's full of good fats. It tastes good too. So there's a lot of ways to get there. You know, the reason really I got interested in nutrition was because of Andy and Kelly coming down with type 1 diabetes. I realized I knew nothing about nutrition. What I was taught was wrong. So it led me, and I had all these overweight patients, and I was just piling medicine after medicine after medicine on. And their numbers looked better, but they were still miserable and overweight and hurting all the time. I wasn't helping them. And really, I'd just rather get somebody, the biggest measure of your health is really your weight, I think. Forget, you know, cholesterol, blood pressure, A1C, just lose weight. I mean, unfortunately, doctors nowadays, I'll tell you a great secret here. Doctors are being paid by how low they get your numbers. In other words, this is really a shame. This is the way it's done now in big groups. If you go to the doctor and your cholesterol's 220, they're going to want to snap you on a statin drug as quick as you can say yes. Well, and they don't tell you what it can do to you. The fact it doesn't prevent heart disease in the first place. But anyway, they're going to snap you on that. They're going to snap you on something for your sugar if your A1C is a little bit elevated, and also probably a blood pressure medicine. You know, get those numbers looking great because they get paid for performance. They actually get bonus on how low your numbers are. So it's a lot easier to put you on a medicine than actually sit down and try to get to the bottom of why you're eating that and actually educate you on what to eat. Most of the time they don't know what to eat. So why don't they tell you anyway?
We got a patient too that got a bonus from his employer for having a certain cholesterol number.
Yeah.
I forget which
Yeah.
one, but
There's a guy that moved here from North Carolina. He's a fireman, and he's coming in to me for general care, and I go, "Why are you on Lipitor? Is your cholesterol that high?" And he goes, "No. If you're in this particular city, North Carolina, if your cholesterol's under 200, you get paid $100 more a year." So here he is on Lipitor, a high dose of Lipitor. His cholesterol was only 220 in the first place. So he was on that medicine for the rest of his life because he wanted an extra $100 when he didn't know that was really a bad thing for him. You know, most of your steroids come from cholesterol anyway, so immediately I took him off of it. But he felt a ton better because every bone in his body was hurting. I was going to have to send him to Dr. Gorman.
Any other questions?
Getting better. But anyway,
Any other questions?
questions? We're running late.
Comments? Concerns? Perfect.
Well, we've got plenty of time, but I want to give them time to talk.
Oh, yeah.
Yeah, you know what I'm
Share
saying?
your
We have
story.
plenty of time.
I'm a vegetarian, and I eat a lot of soy protein. I didn't know it had estrogen. But if it wasn't for Morningstar, I'd be dead, probably. When I eat it I eat that stuff every day. And, you know, so, I mean, are there other alternatives? I mean, I grew up eating meat, and then I stopped 20 years ago. And now I went into the alternatives. But if they're soy protein, they're all basically the ones I eat are soy protein.
I prefer pea protein, but so that's probably a better choice. But as long as you're checking your estrogen levels, I mean, you know, that's a simple, cheap test that you can see. But the United States, the soy is mostly GMO. I mean, you may be getting a better source of it, but soy in general is pretty estrogenic. But if you're checking your levels, and I mean, I'm not against the vegetarian diet at all. As a matter of fact, a lot of athletes are going to it and feeling better. You lose weight. You got to be careful. You got to make sure you're getting the vitamins in and, you know, enough fat. But I'm certainly not against the vegetarian diet. I mean, there's a reason why the folks out in Loma Linda, California, they're in that blue zone. They're in one of the 4 or 5 blue zones in the world that live way longer than the rest of the world. They're vegetarians. They're all Seventh-day Adventists. So there's a lot of good things with being that. So I'm not Yeah, I'm with that.
Dr. Gardner goes a lot into how to prep the vegetables so that you're avoiding the inflammatory spikes from it. He gets it from like, he went to Italy and saw how people prepared the tomato sauce over there so that it doesn't cause the inflammation and the disease that we have here. So there's ways to prepare.
Read Dr. Gundry's stuff. He's a Seventh-day Adventist. He was a vegetarian, but couldn't figure out why he was 60 pounds overweight being a vegetarian.
Okay.
Carbs and lectin. So, you know, you're doing well. So again, what works for one person may not for another. You got to see your tonsils. You make sure your gut's working fine. Anybody that comes to see us, the first thing we say is, no matter what problem they come in, is how's your gut doing? And most of the time, if they come into us with an autoimmune problem, which we deal a lot with, Hashimoto's, all this stuff, diabetes, thyroid, cortisol, adrenals, how's your gut? And every time they have an autoimmune disease, it's, man, my gut's terrible. I'm bloated all the time, or I'm constipated. Well, if you don't fix that, you're gonna have a really hard time fixing their Hashimoto's or their inflammatory immune responses. So work on the leaky gut first, and it's usually not that hard.
No, that's not an issue for this guy.
Good, good.
We check all our levels when we come in.
Yeah.
He's one of our star patients.
Any other questions?
Talk about the smash.
Yeah, I was gonna say, yeah, we're ready for you. If you will please welcome Ashley. Come on up. Ashley has some Smash Meals. Smash Meals has been amazing. Yeah, I've had it before and I love it so much. But I always say that like if convenience is an issue for you, it's I don't know how to prepare the foods, I don't know what's in them, I don't want to cook, I work 14 hours a day, I need it there. Smash Meals is literally here for you, so I'll let you
Oh,
take
here.
it.
So Smash Meals is my business we started a couple years ago. Just like Andy said, we are meal prep. That's what we do. We make food in small containers. So I brought some food just so you could see what it is. I deal with, like he's talking about all these different diets. I get phone calls all the time when people want to say, I'm a vegetarian, do you make vegetarian food? Or I do keto, do you make this? Or do everyone has a diet that they want to follow. So my goal is to have something every week that can accommodate at least a couple meals that fits in your diet, and if not, you know, enough meals to make it through the week if that's what you need. So basically how my business works is we have a menu that's released every week on Monday to our website. From there, you can literally just click on this button, it says order now. It takes you to like this order form. I tell people it's like buying Lululemon on your phone, like there's like an app, you know, Lulu app, I buy my leggings on there. It's just like that, but you're buying food. It goes through the menu, it'll tell you like the nutrition information, it's also listed here. But I do try to say like, if the meal falls into the keto diet, it'll say keto, or it'll say low carb, or it'll say vegetarian. We try to have a lot of dairy-free stuff also, it'll say that. Anyway, so menu comes out on Monday, it lasts, it stays open until Thursday. So when you order meals like today, if you order meals, those meals are to be picked up on Sunday or Monday. We have quite a few different pickup locations. In Kingsport, our pickup location is at the Performance Medicine there on Sunday afternoons. Here in Johnson City, it's at Clark Chiropractic, which is like on Carroll Creek Road. We have a couple of different options throughout the week as well that you can see on the website. Biggest thing I think that we offer is just having food that's already portioned out, weighed, measured, and it's easy. So you save time, you don't have to do it yourself. You literally just pull this out of your refrigerator, stick it in the microwave. So we have a few different options that I brought you can look at before you leave. I personally do eat a little higher carb diet. I have a ton of muscle mass on my body, so I tend to eat a higher protein, higher carb diet. I didn't offer meals like that for a long time because it wasn't like the big sellers. Most people don't eat exactly how I eat. But I have added that in as well. So we have on up here, if you want to look before you go, like we call it the performance meal. It's got some white rice, vegetables, grilled chicken, and then we have like this is a keto meal. It's like an Asian pork bowl. We've got sweet potato stuffed, chicken stuffed sweet potato, breakfast baked. Anyway, you're more than welcome to look around at those. But I will be here if you have any questions that you want to ask me. You can ask now, or I'll stay after a little bit as well.
And I do have to say, it's affordable. Like, you're gonna spend less on this one meal at Smash Meals than you will eating out. I can guarantee that because I've done this.
Yeah, they range from $6 to like $12. $12 just meaning like it has a ton of protein in it. I have some men that buy those, but mainly you can spend between $6 and $8 on the meals, and I have people that spend about $100 a week, and that's pretty much their entire meals for like Monday through Friday.
Well, it tastes good too.
Pretty good.
And those fat bombs are good.
Yes.
Desserts, they're desserts.
Yes. Yeah, so we call them snacks instead of desserts, but we do a lot of like almond butter cookies or paleo cookies. We only use coconut sugar. We don't use any gluten. I don't eat gluten, so that's kind of how all this got started, just offering that. So if you're gluten free, I do accommodate that. And then we try to accommodate other things as well. But with our snacks especially, I have people that, I met with this Mitch Cox today with some of their employees, and they were talking about how people don't want to make like healthy desserts because the ingredients to make the cookies are so expensive. Like if you're going to make paleo chocolate chip cookies, I figured it out, and you can spend like up to $30 just on the ingredients to make one batch of cookies to go home. So we make them in bulk and sell them, and you come out a little bit better by just getting a couple. But that is one of our big things. That we have like, we call them smash bars, but it's like a fat bomb if you do keto. And then we have cookies and muffins and all that stuff.
Why don't you get us ready for, if there's no more questions, maybe next week's session, and what, as far as the Performance Way and empowering you?
Why, yes, how did you do that?
Don't do that. Just spiked that thing way up.
Really,
Yeah, that's all right.
Next week is going to be hormones A to Z. I think if we do anything well, I think we do hormones well.
Yes.
I think we really do. Hormones, we'll talk about testosterone, estrogen, your mother, fat, all that good stuff, progesterone, thyroid hormones, cortisol. We'll be talking about that next week. Week 3 is going to be all therapy led by yours truly, Kelly. God, I feel the camera's on me, but she is waving right now. You cannot see. So Kelly is our licensed esthetician here. We have a new machine here that is ultrasonic technology for a non-invasive facelift. It is really cool. In a short 3 to 6 months, you'll see that my mother's face is frozen.
Give it a little time, guys. Let's
We'll
give
talk
it a
about
little
more about
time.
therapy and what it is. Week 4 is going to be exercise for life, talking about movement. And am I too soon for our introduction for Dr. Paul Gorman? Like,
No,
have
it'd
we?
be appropriate time,
Would
right?
it be an appropriate time? Come on up here if you'd like to make the special. We have a very special announcement. I just don't know if we've announced it yet. Is this like a?
Well, give me a drum roll.
I think your brother Ben.
Did he
let the
really?
cat out of the bag.
Please welcome Dr. Paul Gorman. He's going to be our newest member of the Performance Medicine team, the Performance Medicine Way. And that's it. That
Paul
was
Gorman, everybody
a
knows.
world-renowned
He's a
orthopedic
very
surgeon.
well-known orthopedic surgeon, specializing in hand and upper extremity. And he'll tell you kind of why he's doing this, but when he decided to join us, I mean, it almost just like flabbergasted us, because somebody of his reputation and his knowledge joining our practice it brought us to a new level. We're trying to, like Paul says, everybody comes to the doctor because of one of two things. They're either hurt or they're tired. Now, we can take care of the tired part. Paul can take care of the hurting part. As you get older, your joints kind of have a little wear and tear on them, and things go wrong. I mean, how many people here have had some problems? Debbie, back. Debbie, neck. Bernie,
Shoulder, back,
you know,
knees.
Brenda, back. I mean, not one person in here can't say that Jenny Knuckles.
They hurt so bad.
All that. I mean, we want to age well, and this guy's going to be a key to our success. He does all kinds of cool things. I will tell you, I signed up to be his first patient on, was that last
Wednesday.
You weren't his first.
What?
He had one before.
That's right, I was number 2. I couldn't get it.
If you
But
ain't
I'll second,
first.
but I'd rather be second. Last. But anyway, I try harder. But I've had this shoulder problem for about 8 months. You know, I work out a lot, but literally I haven't been able to do one push-up in 8 months because I did something to my shoulder. And I'm a workout nut. And so I've really fallen off. And so all I can do is bike. So I couldn't do one push-up. So I made a point with Paul, Dr. Gorman, and he immediately says, do a push-up. Couldn't do it. So he fiddles around with me, puts me through all these motions and everything. He says, you have subacromial bursitis. I'm gonna fix it. So he puts lidocaine in there. How many cc's you put in there?
Just a couple, thimbleful.
Just a couple. I didn't feel one thing. I thought, have you really stuck a needle in deep in my shoulder? I didn't feel it. So about 3 minutes later, he says, do another push-up. I do the push-up, no pain at all. I ripped off about 5 or 6 probably. So then he takes me back and puts the steroid injections in there. And ever since then, I'm normal. So he's a magician. He cares about patients. He really goes along with our philosophy on medicine. I mean, we're around the same age. So we've both been doing this 30 plus years. So, you know, our philosophy is the same, to help the patient, to forget about dealing with insurance companies and bureaucracies. Just patient, doctor, help me, I'm hurting or I'm tired. So it's just a great thing. Thank you for doing. Welcome to our practice, and you know, it's going to be the greatest thing ever.
It's gonna be a lot of fun. Well, I just wanna say, I'm also Dr. Rogers' patient. And we're not only equally yoked in the way that medicine's going astray in so many ways that it's distracted from treating the patients, all of you, including our spouses sitting here, treating the patients with the problem, not just the problems the patient has. And when all this focuses on numbers and the metrics of evidence, you know, the chart has to show evidence of certain numbers. It's the whole system of third-party payment for healthcare is ignoring the experience. And with probably close to 40 years of experience, he just told you that of a few of his patients where he has listened to and thereby treated the patient with the problem and the complaints, not some lab value. And nutrition is such a huge part of this. We were taught the upside down triangle. We were not trained properly, and the medical community is motivated against doing things simply and rightly. You know, the GI docs want them in the office, the immunologists in the office, the rheumatologists in the office, but a lot of it starts with this nutrition. And I could be a better disciple and intend to learn more as I work here. But Andy, you did a great job. I don't want to deflect. Bravo for a job. I was proud to sit back. I was proud to listen to such a great presentation.
Thank you.
Yeah, so I'm going to kind of be the bone and joint guy. I laid down the knife after 30 years of surgery and took a 6-month sabbatical. My wife ran the office the last 15 years. I was in a big orthopedic group here for 15 years prior to that. So just part-time, day or two a week. For what ails you, I'll certainly try to help. I will listen, examine thoroughly, and help you get through it, get you to the right person if it does need surgery.
Tell your friends.
Yeah, his website is getting all that information, my old website. You can just search on my name or my old practice. It'll direct to why we're going to do what we're going to do and how we're going to do it.
You're the only surgeon I ever seen a patient that you wouldn't operate on until I got the vitamin D higher. I mean, how many
And for
surgeons
14 years,
vitamin D?
I've gotten his patients, and they come in 60 looking 50. Their labs are normal or near normal, and they're already primed for surgery. That is so often not the case with many other physicians' patients. So we've enjoyed the sort of the iron sharpening of enjoying treating each other's patients too. So it's just a natural fit.
It's going to be good.
It's already
really
been fun.
appreciate you being here.
Thank you all. Thank you all for coming. Thanks.
Thank you. Thank you for coming to our series. Come next week. Thank you for tuning in. If you're tuning in on Facebook Live and a party.